Health Minister Dr. Zweli Mkhize has officially launched 67 mobile screening and testing units to be deployed nationwide to all districts and metropolitan municipalities. Let's cross to our reporter, Hasina Gori, who's in Yeoville. Very good afternoon to you, Hasina. We know that the highest incidence of infections in South Africa at the moment is in Gauteng. What's happening where you are?
Good afternoon, Nzinga. Yes, as you mentioned, Gauteng and Johannesburg specifically is the epicenter of the coronavirus infections in South Africa. In a bid to flatten the curve and to stop the spread of the infection, these mobile clinics and testing have been put high up in priority. The Premier, David Makhura, earlier this week said that they will be launching these testing sites as well as mobile clinics in areas that they call vulnerable or priority areas, where people might most likely be affected or in contact with positive coronavirus patients. We here in Yeoville, in the inner city of Johannesburg, where one of the mobile clinics have been brought in to the clinic outside of the actual perimeters of the clinic to ensure that they keep separations between those that might have symptoms and those that are just here for everyday normal incidents of health issues. With me to speak more about the mobile clinic here is the area manager for Gauteng. Thank you so much for speaking to us. Can you talk me through the mobile laboratory van that we're seeing here? What is the purpose of it and what can it do?
Yeah, thank you for that. The mobile we're seeing here is one of our older versions of the mobiles, and we are in a process of already procuring a few for all the provinces. Currently, we've got one here, which you see behind me. The main purpose of us being here is to do the sampling from the patient who are seen to be having the symptoms of the coronavirus. And we're collecting the samples here and we dispatch them immediately to the laboratory for testing. The objective of this is that in the long term, we will be doing the testing inside this mobile. The issue is that we're waiting for more of the reagents, or the supplier will be providing us with additional reagents, and we'll be installing gene experts analyzers into this machine so that we can be able to test and move closer to the community, and we can be able to do those testing there. But for currently, it is meant for sampling, and that's what we are going to be using them for.
For those that might want to come and visit one of these mobile vans, what is the process that will be taken? Do they need a referral from a doctor? Do they need to show symptoms? Just talk us through so they can understand if they feel they want to come and get tested.
Yes, thank you for that. Yes, we're working in collaboration with the Gauteng Department of Health, who has identified certain hotspots in the province, and they indicate to us to say they will prefer us to station at particular sites, and we go place this mobile in those specific sites identified by the department, and we will be able to be collecting samples. They come through the clinic, and then we will be able to be collecting the samples. They come via the clinic because, as you see here in Yeoville Clinic, we are linked to Yeoville Clinic, and the patients come through the clinic and they will be directed to the mobile to come and do the testing. That's the process which we will follow, as well as we go into the community in particular areas where we will be informed by the province to say, this today we will be going to this area, and we'll do the same, but it's mainly through the collaboration and the hotspot identified by the department.
How important is testing in flattening the curve?
The important thing is that by testing, we will be identifying the infected people so that they can be able to be isolated, in terms of avoiding that they can continue to spread the disease. They go on isolation, and if we can be able to get more of them tested and be able to isolate those people who are positive, then we will be able to approach the way of starting to flatten the curve, because once we can control those who are infected and have lesser people getting infected, then the curve will start to be flattened. Yeah.
Thank you so much. That was Mr. Bahule speaking to us here outside Yeoville Clinic, where one of the mobile laboratories of the National Health Laboratory Services is stationed. We know that the Health Minister said that 67 of these will be sent out throughout the country to ensure that they can go into vulnerable and hotspot areas and test people. We know that health workers in this area were also going door to door, screening patients, seeing those that might have any symptoms or may have come in contact with an infected person to ensure that they can isolate them and quarantine them. This in some attempt to stop the spread of a coronavirus, especially in those vulnerable areas. As you heard from him, currently there are only 5 of these that are being taken out into communities across the country. The rest of the 67 are still going to be taken out. Right now, they cannot do on-site testing, but what they can do is sampling, which then is sent to the laboratories. These are just some of the attempts by government to play their part in eliminating and bringing down that infection rate.
Hasina Gori coming to us live from Yeoville there. 2 flights carrying Europeans will leave South Africa this evening. The German government